My name is Monika. I'm CEO of the National Institute for Social Integration, and I'm very pleased to be here with you today. As one of the work that my organization is doing is one of my team since 2018 is developing alternative school for delinquent youth, as well as since 2019 I have an honor to do the consulting work with the municipalities in order to bring a new concept of impact procurement to Lithuania. So today, in this last 1 hour and 20 minutes, we will be focusing on the sustainability. And sustainability, I would say, through the few aspects. So starting from, of course, sustainable impact that we are delivering to our youth and kids. Then, of course, is a sustainable financing and different models that we could apply in order to ensure that financing is not fragmented and it actually help us to deliver the sustainable results and impact. And we will be focusing on the partnership between governmental, non-governmental sector, private sector, because it's usually the key in order to achieve the best results that we could. And I would like to ask to join me here on the stage our 4 amazing speakers who will be talking here today. So first is Ulrik Lerbech Vinther. Simona Uvarovaitė, Loreta Matolienė, and Marjatta Kekkonen. Thank you guys for joining us here today and sharing your practices and experiences. That would be very significant to hear. And as we don't have a lot of time and I don't want to take a lot of stage, I would like to ask on the stage our first speaker. It's Ulrik. He's a consultant in the Center of Urban Regeneration and Community Development in Denmark. And he will elaborate and help us to understand how the empowerment of the communities can actually help to work with the marginalized groups. So please, Ulrik, stage is yours.
Thank you so much. And firstly, thank you so much, Monika and Vida and the organizers of this great event. Rarely have I been met with such kindness and hospitality as I've experienced here in Lithuania and Kaunas. So it's been a great experience. Thank you so much. I'm very happy to be here today to share a few perspectives on community work programs as an important context measure to preventing youth delinquency in marginalized neighborhoods in Denmark. First, inspired by Natalia's presentation yesterday, I would like to start with an excerpt from an interview I made with a young guy last year in a field study I did in a marginalized neighborhood in Denmark. And it's often a very bad idea to change in your plan for your presentation, but I was inspired by Natalia, so I'll try to do so. So this is Jamal, and he's 17 years old, and I meet him in his neighborhood. And he tells me that school has always been troubling for him. It's been up and down, as he says. And he's very used to meeting police in the street in his neighborhood. As he says, it's normal to him to meet the police, and he's been doing so since he was 14 years old. And this is why he's very dependent on grown-ups in his community that are working relationally and that are advocating for him. So Jamal tells me, I was checked up in the street by the police at the age of 16 together with someone who was very known by the police. So I received this letter of concern. My parents got this letter that said I had been stopped that day with someone who was involved in these very bad things that happens in the neighborhood. So my parents went over here to the housing organization offices for a worry conversation, as it's called, with the police. Hamid from over here participated in the meeting as well, and Hamid is the community worker. And Hamid told the police and my parents that Jamal is one of my employees. He works for me in an after-school job. So it's possible that you found him in bad company, but he's a lot better than this. And Jamal tells me that it helped me by showing those who had the wrong eyes on us by showing them how we really were. And I think this talks to something I will say later about the importance of healthy spare time activities for youth in these neighborhoods. So, 3 quick points to take home. First, addressing the underlying causes of crime is crucial for creating long-term change, meaning preventing social, structural, and spatial inequality, and not only focusing on individual behavior. Secondly, cross-sectoral community work in Denmark could inspire approaches to organizing and governing context-based prevention elsewhere in the Nordic and Baltic countries. And finally, complex issues have no quick fixes. So the partnerships are associated with both great potentials, but also great dilemmas in practice and in organizing. So I'll just tell you a little bit about where I'm from, where I work. I work in an independent knowledge center and broker that is co-financed by the Danish state and something called the National Building Fund. And I'll get back to the National Building Fund. So we are 15 academics with backgrounds in anthropology, sociology, city planning, and political science. I'm a political scientist, and some of my colleagues have PhDs as well. I don't. We are tasked with producing evidence and practice-based knowledge through studies and evaluations to assist community development work in Denmark. So, what kind of social work do we study, and in which context do we study it? In Denmark, there are 50 community work programs, and they are 4-year partnerships between the non-profit housing organizations and the municipalities, and then a lot of actors in community, local community as well. And there are actually six of these programs in the municipality of Copenhagen that Marie works in Idrætsprojektet in the municipality of Copenhagen. And I also think that Marie and her colleagues co-work with or collaborate with these master plans in some of these neighborhoods. So it's important to say that in Denmark, 1 million people live in the non-profit housing sector, and I will explain what the non-profit housing sector is. But 1 million people live there, and approximately 200,000 people live in neighborhoods that are somewhat encompassed by these community work programs. And compared to society at large, the concentration of social issues in these neighborhoods is rather striking, also in Denmark. Meaning substantial poverty and social inequality in life chances for the residents who grow up and who live there. So in the community work programs, there are 4 focus areas for the social interventions. They are crime prevention, primary and secondary, and thank you so much to Bjørn from Fryshuset. I think there are some similarities in the focus in this work and in the work that his organization does, in that most of the work is dealing with promotion and prevention, and not so much reaction. So I think that's a parallel. But the 4 focus areas are crime prevention, life chances and education, employment, and social cohesion and citizenship. And here you see the characteristics of the neighborhoods: higher levels of delinquency and crime, lower income households, lower levels of employment and education among parents, and the controversial one in a Danish context, higher share of residents with ethnic minority backgrounds. That's one of the parameters for defining the areas as well in Denmark. And the aim of these programs is to enhance the well-being of the residents and the community at large, and I'll get back to how. But what is the Danish non-profit housing sector, and what are the financial foundations of these programs? This is a complex model, and I'll get back to explaining it. But first, the non-profit housing sector in Denmark is owned and governed by the tenants through non-profit organizations, and it's co-funded and regulated by the state and the local authorities. So the housing is universally accessible through a waiting list system, and it's not like we know social housing from other countries where it's reserved for those with acute housing needs or specific socio-economic problems. This is for a broader part of the population who lives in these neighborhoods, but usually families with low incomes as well live in these neighborhoods, but they are not reserved for only people with social problems. This is the financial model for community work programs that was introduced in Denmark in 2006. And a bit of background is that in 1967, the National Building Fund was established, and the fund was financed by rent payments from the private non-profit housing sector. So when the rent paid by tenants to the non-profit housing organization exceeds the costs of mortgages and daily operations, a part of this is deposited into the National Building Fund. And in 2006, the Danish Parliament decided that the National Building Fund should also start subsidizing social interventions, in addition to subsidizing material upkeep and renovation of the housing stock, which it had mainly dealt with until then. And this meant that local departments of the non-profit housing organizations that were experiencing substantial concentration of social and poverty-related problems could now apply for subsidies to carry out local social programs to alleviate these problems in cooperation with the local municipalities. So these programs are co-financed. So 60 to 75% comes from the National Building Fund, and this is around 20 million euro per year. And then 25 to 40% is co-financed by the local municipality and the local non-profit housing organization. So what do they do? Here are some examples of the efforts made to support the well-being of children, youth and families in these communities. So the efforts focus on various dimensions, as you can see, in the everyday lives of the residents, in connection with the social risk arenas and the institutional contexts that we know have very much preventive importance, meaning, for instance, family and home, spare time, school, and street life in the neighborhood. A core principle in the master plans is their bridge building capacity. Mika talked about the role of the Icehearts as a bridge builder as well, I think, and that's also a core element in the community work programs in Denmark. And this means that their preventive effect is linked to being a local presence that doesn't operate alone and doesn't operate in a vacuum. It aims at mobilizing and bridging existing resources and preventive resources in local community and in core societal institutions at large. Slower, okay, sorry. So I'll give an example in a bit about how they work on securing after-school jobs for youth. But first, let's take a look across the efforts and what's significant about them. And I can see that time is running, so I'll do that quickly. They have 4 distinguishable characteristics. The first one is that they are area-based, and this means that the programs are local. Staff are located in offices, in community. They work from within the setting of everyday lives of residents, and it means that they are more easily accessible to residents, as well as the local presence provides easier access to the residents, many of whom are often harder to reach for authorities, as Bjorn also told about in his presentation. Secondly, they are network-based, as I told you, so they are examples of collaborative network governance, meaning that they mobilize and connect different resources across different sectors and disciplines in the communities. They support them in working together around problem solving in a place-based setting. Thirdly, they are trust-based relations. They work with trust-based relations, and this means that the community workers operate with no formal authority. They are not mandated to sanction or coerce residents. And it means that the interaction with the residents is based on voluntary participation on behalf of the residents. And then finally, the programs are more focused on the resources available in the community and working towards supporting and activating these resources, enabling and empowering and supporting the communities to become self-reliant. Yeah, okay, so I was asked to bring a concrete example of some of the work that's done in the community work programs. And after-school job initiatives are widespread in the community work programs in Denmark. So here the assumption is that when we facilitate and provide youth access to healthy spare time activities, such as after-school jobs, it will have a preventive effect on delinquent and criminal behavior also in the longer run. And this is in the program of the municipality of Køge. They have some marginalized neighborhoods there. So they work with this through a network-based partnership between the non-profit housing organization, public institutions, and private local industries, as you can see on the left here. So from a neighborhood side, the program supports youth in job searching and also in guidance and motivation towards vocational education. And they encourage and safeguard the employers, who can be any of the three in the network. And since 2014, this community program has facilitated 1,000 jobs, after-school jobs for local youth. This is just a graph from a national evaluation. I didn't do it. It was another organization in Denmark that did it of the entire 50 programs in Denmark. And it shows us that for youth who have participated in after-school job interventions, the probability of having a spare time job in the following years is significantly and markedly higher, as you can see in the right. Than for youth who have not participated in these interventions. And this means that the initiatives and the social programs seem to increase the tendency for youth to have spare time jobs in the later years as well. But I also have some reflections, because the after-school job initiatives are typically not isolated. They are part of a broader programs and strategies, concurrently working with relation-based with youth and families and communities. And I think Jamal in the beginning was an example of this. It's not only about providing the spare time job for him, it's also about mentoring him and advocating for him when he's in contact with police or municipal actors or others. So it's a lot of relational work around the jobs as well. And do they prevent delinquency? I think that's a very tough question to answer, but I think Jamal gives us an indication of what meaning they can have. And I'll skip this. You'll have it for the slide deck. So finishing off, here I have contrasted some of the ideal typical characteristics or differences between community work on one side and public welfare provision on the other side. And this is very simplified, but I think it's illustrative. It's important to note that local community work programs in Denmark are a supplement to the core social policies and programs of the local authorities in Denmark, and this is the municipalities. In Denmark, the municipalities are in charge of the main production of welfare services, so in scale and scope they are far larger and more extensive than the community work programs. However, community work programs offer important and valuable supplement to this core welfare system. And I would argue that many of the preventive effects and potentials that we see and that we have heard about in other presentations as well, that they arise from a social work with youth that manages to acknowledge and operate in this ambiguous boundary space. So finishing off, how does the boundary work look from a target group or from a youth perspective? And I think this is very, very important. So my excerpt from the interview with Jamal was an excerpt from a field study my colleague and I did last year in 2 marginalized neighborhoods. And the study focused on understanding youth's own perspectives on the challenging transition from primary school to further education. And the background for this study was that in Denmark, 25% of the 18 to 29-year-olds in the neighborhoods have primary school as their highest education and are currently not doing further education. And this is, compared to the rest of the country, twice as many as in the rest of the country, where it's only around 12 or 13% who only have primary school as highest education. So this is a background for this interest. The study touched on the youth's experiences of the institutions that they meet in their own neighborhoods compared to the more traditional welfare provision they are used to or often try to avoid. So they tell us a lot of story about their experiences from primary school, very, very bad experiences. So I brought these quotes because I believe they offer some important food for thought as to what actually constitutes relevant interventions from a youth perspective. I think this is Jamal as well. He says, not that many people understand the kind of life you have outside of school as they do here, the community workers. Here they are more concerned with what you do after school. No one else really is. Another guy says, I don't know who they work for, the workers here. Even if they work for the municipality, I would still trust them. They have something very special. And I think this is very important because we also study and meet municipal workers in the neighborhoods. And it's not so important whether they're municipal or not, because from a youth perspective, the system is not an absolute entity. It's more about relations and settings and feelings. And so I think municipalities, and I think the Idræts project is an example of this, can work in this way as well. That's my time. Other quotes for you. Some of my colleagues' publications. Thanks so much.
Thank you so much, Ulrik, for in general, that you helped us to elaborate key, very important aspects as not only community engagement, but the part of the impact measurement, because you already can show the results that is very clear, working and investment is going in the right direction. As well as I'm all the time very much fascinated about the Scandinavian financial models and how much creativity is inside there and how much, in a way, there is a flexibility when you are thinking about it. So it's a very actually nice transition to our next speaker. I would like to invite Simona Uvarovaitė on the stage from Innovation Agency. As the Innovation Agency, since probably 2018, is doing a really great job and took a leadership regarding the transition of the public services in Lithuania. And Simona can tell us about what kind of measure as the impact procurements we are trying to apply here in order to make services sustainable.
Hello, everyone. I hope you can hear me well. So my name is Simona and I work for Innovation Agency. So just to begin with, what is Innovation Agency? So we are a new organization. We were established in 2022, so 2 years ago, by the Ministry of Economy and Innovation. However, we are 3 organizations merged in one. So even though we are a new organization, we have 3 organizations' experience and knowledge behind us. So we know some stuff. Yes. So what is it that we do? We basically work with businesses from different stages, from early start, entrepreneurs, startups, and then businesses that are ready to scale, grow, and export. So obviously, as an innovation agency, we facilitate innovation. We work with different business competences, internationality, so we help businesses to export, to find connections abroad. We also provide investment and networking. And since we work from businesses from start to when they become really big businesses, one of the business type that we work with is social businesses. So what we try to do is to foster the social business ecosystem in Lithuania, which, since it's quite early stages, we don't have that well-established ecosystem. So what we do here to help, we provide training on impact measurement. Since an early stage ecosystem, this is a competence that a lot of social businesses in Lithuania are lacking. We also have a social business database where social businesses can voluntarily register on our platform and become also more noticeable and easy to discover. And we also have a social business accelerator program which we launched last year to help social businesses grow, gain important competences, and scale. And then another side of this activity is the work with municipalities, which I will talk more about today. So we also do certain activities in this area. So first of all, we do these small presentations or workshops where we go to municipalities and we talk about transferring of public services, why it's important, how they can do it, and just kind of guide them through that process a little bit. We also have a project where we help to implement the public service delivery model, and I will talk about that a little bit later. And another thing that we did in 2019, we prepared the guide for the transfer of public services. So why do we do it, and why do we even talk about transferring of the public services? So it's not something that the Innovation Agency just thought about. It's laid out in our strategic goals. So for instance, in Lithuania's Vision for the Future, Lithuania 2050, and in other development programs, we have this goal that 30% of public services should be transferred to NGOs or social businesses. And in that way, we believe that the public services become more efficient and they reach their target groups. So that's why we do it, and we are aiming to transfer 30% by 2030. So to help municipalities, as I mentioned, we prepared the guide for the transfer of public services in 2019, which serves the municipalities basically as a toolbox. There is described how they can do it, the different ways of transferring or the handing over of the public services can work. Of course, there's a very important part is the impact measuring methods, since in Lithuanian municipalities this is quite in early stages as well. There's also some funding sources in the guide and analysis of legal gaps. However, this is just words basically. Of course, it's a book, very useful, but we also try to implement it in practice. So we have a project it's called Transfer of Public Services, which we also have from 2019, back before we became Innovation Agency. And from 2023, from last year, we have it on a bigger scale. So what we do in this project, we involve 6 municipalities a year. They, of course, apply to participate in this project, so we select 6 municipalities. During this project, they go through 3 different project stages that I will elaborate on as well. And the result of the project that each municipality that participates in is the 6 public procurement projects where they procure impact. So a little bit more about the project itself. So as I said, there's 3 different stages to the process. So the first stage is a design thinking workshop. And this one is a very practical, hands-on stage. This is where our consultants, they go to the municipality and basically they spend the whole day with the municipality workers in their municipality. So it's for each municipality, the stage takes different times. So during this day, municipality invites, of course, people that are involved in the project, so municipality workers. They also invite NGOs that work in the area that they want to elaborate on or like work on during the project. And they also involve the recipients of the service. So let's give an example. If the municipality wants to work on youth delinquency, then they invite NGOs that work with this area in their municipality, as well as they talk to the youth on the phone or in any case they like, to also understand what is actually the problem. So the whole goal of this stage is to understand the problem, what is causing the problem, what are the consequences of the problem, so the municipality workers can really get into all the nitty and gritty of the problem and really understand the cause of it. And the result of the stage, of the whole workshop day that they have, is a social problem that they identify, they understand the causes and the results of it. So they choose a problem and they work with it throughout the project. And we also, of course, want to involve different sectors in the stage as well, so we promote cooperation. Then we go to a second stage, and this is a longer stage, as the first stage is only 1 day, but the second stage is it can take up to a couple of months. And this is where the municipalities take that problem that they now really understand, and they know from their NGOs and from the target audience what is the problem and how they want to resolve it. And in this stage, they basically identify the indicators or the results, what should be achieved so the problem is solved, right? So after the design thinking, they do the theory of change. So it helps them to answer the question how the goal must be achieved. In this stage, it's only municipality representatives that participate in it, with our experts as well, and it's probably one of the most difficult stages of our project, because this is helping municipalities to change their way of thinking. Because in Lithuania, at least, we have very often we see that when municipalities procure their public services, they just buy a number of beds or a number of courses or very quantifiable services, instead of really looking through the impact perspective. So here it's quite challenging for the municipalities to understand how we can actually procure impact, but we definitely give them a lot of time to understand how this works and do this theory of change that will later on will be put in the third stage. So the third stage of the process of this project is preparation of the impact procurement documents. So here we have, again, municipality representatives, and they work with the legal advisors in preparation of public procurement documents. And again, this is very new to a lot of municipalities, because they don't really know how to put those indicators that they did in stage 2, how to put them on paper. And a lot of help is basically needed in this stage. Very often municipalities also choose to put this mechanisms of bonus and sort of like a fine system. So for instance, if the supplier that they will be buying the services from, they achieve the results and they over-exceed it, they might get a bonus. And if they don't achieve the results, they might get a little fine. But this mechanism is there not only to protect the municipality, but also to encourage the the service providers or the NGOs or social businesses to really try to achieve the impact that has been defined in the previous stages. And also in this way, municipalities, they also, it's kind of the point of this procurement is to work on the demand and the supply side. So the NGOs, that they can work with the municipalities, they can be a part of their service provision, and municipalities also can involve the third sector organizations in providing those services. So result of this stage is the public procurement documents for impact procurement are prepared for each of the 6 municipalities that are participating in the project. So far, by 2024, we have included 12 municipalities in our project, and also this year we already have selected 6 more. So this year we're already starting. So we're gonna have 18 municipalities by the end of the year. And the municipalities, while they are in this project, they choose themselves which area they want to work on. However, most of the times, municipalities choose to work with certain social problems. For instance, people with different disabilities, or local tourism, or young families, or single mothers, single parents, long-term unemployment. However, one of the problems that they choose most of is youth delinquency. So what are the benefits that we see so far from working in this sort of way? So first of all, as I said, this also is this way of demand and supply, that municipalities can work with their local NGOs, with their local social businesses, and involve them in the providing of the social services. And as well for the NGOs and social businesses, is just another revenue source, and also being involved in this in basically solving the problem of your municipality. And we can also see that in the course of the process, the competences of municipality workers, they significantly grow. They change their mindset from thinking about quantity, just how many services we provided, how many people we gave those services to, and instead they start to think what those services actually achieved. Did we help those people? Did we contribute to solving the problem? And of course, one of the main objectives of handover or transfer of the public services is to ensure the service quality, because we can see that the NGOs or social businesses, they understand the target group that they work with most of the time way better than municipalities do, because they meet with them every day. They know their problems much better than just people from municipalities, for instance. Also, another point we can see, or we cannot really see in Lithuania yet, but we based our project on analysis, and we are hoping that by doing this, by focusing on impact and providing, putting that impact measurement in the procurement documents, in the long term, we can also save the public sector, the public's budget from 10% to 30%. So this is our long-term goal, what we're trying to achieve in the long term. And of course, we try to foster the social economy and entrepreneurship, especially in the smaller municipalities. So this is how we work, but of course, it's way more interesting to hear from people who actually implement those projects and participate in it. So that's it for me, and thank you for listening.
Thank you so much, Simona, not only for the presentation, but for the work that you are doing. And Simona is the key person that usually municipalities are reaching out and presenting their problems. Sometimes they are end up with impact procurement, sometimes they are end up with workshops, so I would really recommend to contact her if you want to apply different models of financing in your municipality. But to actually show probably that it could work and it could actually bring very nice and sustainable results, I would like to invite Loreta on the stage. She represents the Šiauliai region municipality, who were one of the project participants and who actually developed the impact procurement documents and procured services from their social partners. So please, Loreta, a little bit of technical information. The presentation will be in Lithuanian, so if you are English speaker, please put up the headsets.
Hello, good afternoon. This conference is indeed a great experience for me, and it's very nice that everywhere there are people who care about something that they do, care about youth, care about something that we are prone to do all together, and this is great force that we have to use. I was going to learn English, and this is great impetus for me to indeed start serious learning, because this is the great spirit I have to also experience and share. And my presentation will be about the selection to listen and understand. We've chosen to listen and understand. My postgraduate studies and work started at the Socialization Center. I was working in this institution with children who were engaged in some criminal deeds, and the ones who were sometimes forcefully brought there for any discrepancy. The specificity of our activities then changed. I started to work at Children Protection Service, and now from 2020 I'm employed as the coordinator of interinstitutional cooperation. I am responsible for services that are provided to children at the municipal level, especially children who were engaged in some criminal activity or delinquency. Perhaps this impact of my previous jobs involved and enabled me to understand it from inside, because I saw children who were brought to the center. I saw children in families when we were visiting families with high social risk or monitored families, and I can compare this child now who came to us and who has his or her opinion, and I also have my opinion, and I'm keeping to this opinion that there are no bad children, there are no criminal children. The Commission of Child Welfare at the municipal level children come who did some delinquent deeds. And monitoring of children means that we have to work with them at their environment. We don't have to bring them out of their usual environment and family or home. We analyze a lot of information. We collect a lot of information about this particular child and his or her family. And something that I wanted to also emphasize here, that after collecting this information, this delinquent behavior of this child is consequence of something that had happened in his or her life. Sometimes it was somehow omitted, not heard, not understood, and the consequences then are felt later, because this is the child who did not receive assistance, and the behavior is already advanced when this child is in our view, when he comes to receive our services. So we could not ignore facts about some delinquent deeds, about also seriousness of offenses. And I indeed am happy because we have a great team in our municipality. These are my peers, and we understand that we need to understand what happened in a child's life, why this child selected to behave delinquently, and what tools are available to change this way of behavior. We selected the way of listening and understanding these children. And to understand the problematic behavior, according to Valia Sher, psychologist, is to understand the approach of this child and also understand his experience. Is it easy task? No, not at all. Because in our system, we have the mechanism when a child, delinquent child, from any of the educational establishments or any other institutions, they have case manager, and therefore the services are coordinated. They are provided in coordinated manner. So can any specialist who is assigned to coordinate such activity is able and capable of doing this and understanding problems? Because when the minimum and medium care applied for this child, and when the child comes from a socialization center back home or to the street, and we understood it's not enough. We needed to change our approach. We needed to have specialists with specific experience, and we also needed innovative services that should be provided, because something that we have now at the moment does not have any result, does not bring the proper results. And we have this innovation agency who invited us to start about this innovative way of thinking and started project on how do we have to provide services and how shall we transpose some services to NGOs. There should be some mechanism. Everything should be according to some terms and rules. And of course, we have to see the result. We have to find ways. We need to know what we have to require from service providers. And indeed, the process is very complicated, but with such great partners, there are no obstacles left. We have very productive result, I'd say. Together with Simona, we already discussed what are the ways to purchase services, and we used the suggestion of our partners, their option to look at the problem broader, and we invited people who are not indifferent to delinquent behavior, be it employee of a municipal level, be it employee of a library, perhaps NGO, perhaps it's someone who works at school. So all stakeholders who would be willing to join this task force, who wanted any opinion to share, we invited them. And there were also family representatives who also expressed what they need. So we came down to this common denominator, and it provides us a lot of ideas. What can we say? How can we describe this delinquent youth? Of course, the child was engaged in some criminal activity. It's obvious, because we see only outer side of it. But do we want to also get insights? Sometimes we don't think about it. We sometimes don't think that it is necessary to get in-depth and insight. So we focused on that. What child comes to the commission? What is the case of this child that is in our view? What is the environment of this child? And what is the institutional approach, including resources that are available to assist the children, and what can be changed at all? This is one of the design task force when Simona mentioned the drafts that were provided, and we wrote what is important to us. So what it is about child. Of course, traumatic behavior, it's of course crisis, it's of course being mature, then of course some diseases that were determined is important. Perhaps it is adaptive disorders, it can be some mental disorders, so anything that can be linked with changes because of consumption of some substances or drugs. And of course there is a lot of other disorders that can impact child's behavior. Are we sure that anyone can be in such situations with children and anyone can work with them? No, not at all. And next we understood the following thing, that it is very important to check groups, because if a child was diagnosed any disease, so not a child, but we had to adapt to this child and create a favorable environment, including behavior, and also proper environment should be changed for the child to feel comfortable and to be provoked as little as possible this negative behavior. And if you check the cases of children who come to our commission, so sometimes the intervention of a psychiatrist or psychotherapist are necessary, because these are children who don't have dreams, not knowing what they want, not confident by themselves, don't believe in those around them, not accepting help, unable to adequately react, permanently in defensive position, living in virtual space, doesn't feel loved, doesn't feel listened and heard. Sometimes there are also bad dependencies, and of course this entire bunch of problems or issues sometimes is linked with the fact that this child can be in a large family but feeling very, very lonely. The child that does not belong to anyone. And this is what we see in our meetings. These are the specific cases of children. Pilot project succeeded in very exact analysis of the situation and our requirements. Also, we had to formulate requirements to our providers. Our aspiration was to buy services from NGOs, and that was the open center of Šiauliai district young people. This center has been functioning for 24 years, this Open Šiauliai District Youth Center. They also had experience in working with problematic families, and something that appealed to us very much was their approach to a child. The thought that services should be changed was developed together with them. They were implementing projects, inviting a lot of organizations, including municipal partners. And during that project, there were some innovative services that had not been created in Lithuania earlier. This favorable environment, group assistance, 10 easy steps, that was the name of this service, that was flexible and safe help, close to teenager constantly provided, together with training and assistance provided by specialists to also family members or child's representatives. So we selected that particular Šiauliai District Youth Center as our partner. Well, we already spoke about services, and they are more or less similar or very alike. So the principles of our teamwork are that you have to necessarily feel peer respect towards each other, and that should be the basis of our cooperation. 100% attention should be provided to the child. And to us providing these services, it is necessary to know strengths of the child and also transpose them to the ability to develop. It is also very important to provide services, and it should not, a provision of service should not become one more trauma to this child. It should be favorable, in other words. So this opinion and approach that during the project Easy Shoes Lengvi Batai, while we discussed with children, they were very sincerely expressing what they need. I memorized one girl who mentioned that to my family, institutions were providing services, and in my life, chaos started. It caused chaos in my life. I wouldn't wish it to anyone else to experience, because each institution who was joining this work for a child have their own goals, plans, tasks, and so on, and they need to also account for their results. And sometimes while we think about our goals and tasks, we forget also other institutions. We don't coordinate this approach, because this child mentioned that everyone knew what I need, but no one asked indeed what I would need. So the principles of activity indeed are very important, and while providing this service, if there is minimum care assigned to a child, there should be some case manager person who would be assisting, attending this child, including the social centers, including sittings of commission, including school activities and other meetings as well. And then it is a matter of establishing trust. Later, we have in-depth case analysis. We decide whether therapists, psychiatrists, psychologists are needed, and in each case it's tailor-made approach and services that could be provided. And we plan also assistance from a specialist point of view. Children are prepared to receive this long-term therapy, because the ones who work with children know that it is very difficult to reach the stage that child would be willing to receive this service. It is indeed very difficult to achieve. Next are training. Experiential activities, and perhaps visualization will also help my presentation to be nicely delivered. So these are specific photos, and a lot of activities were done by those marginalized children who felt unnecessary, unwanted by anyone. They wanted to establish their premises, they were lacking funds, and they, well, applied this methodology, do it myself, do it yourself. So they were painting, they were collecting furniture, they were sewing curtains, and they indeed did a great job at this basis, at this premises. They even produced T-shirts with slogan, "I am a host, I am owner or landlord of this premises." And of course, we were also checking what other services could be in demand. They also were provided training capacity. Sometimes they went there together with their parents, and we indeed wanted this process to actively include education establishments, teachers, families, communities, and also NGOs that were in view. Because indeed this general approach to child should be changing. And there should be, of course, good examples to follow. What changes do we see? We see that children are willing to join the activities, they are willing to get in touch with us, they are willing to receive some services. And it's also an important item from one experience, one case, when we expressed and explained the plan to a girl. So she asked, "Is it plan for me?" "Yes, it's for you." "I've never seen such good plan. Could we expand it or prolong it for 2 years?" So perhaps this is the evidence when a specialist is capable of getting into good relations with children and child asks for extension or prolongation of this plan. So indeed there are specialists who care. That's a good evidence, and perhaps children feel this sincerity. So for our workers, it is a successful story. We cannot mention any percentages or good cases, examples, because the service started only at March 2023, so it's only 1 year passed since. So indeed, perhaps we lack some evidence or some statistics. But it is all about joint participation in our activities together with parents, together with other stakeholders. It's strategy to change lives of the children, not to be afraid to express their feelings and even provide some pieces of advice to us. They say you will never change all children and you will not be able to assist all children because you are too few. But even if you assist to 1 or 2 children, we ourselves then we be expanding this good practice. We will be working peer-to-peer at our neighborhood, at our schools, and they would be already, well, expressing the wish to transpose the good practice, to multiply it, to share the good knowledge that they received at the center, something that we could only dream about. And the municipality, while seeing the activities, decided to do one more important step. At the beginning of my presentation, I mentioned that children should be spotted as soon as possible. And we indeed are looking forward to cooperation with schools and other stakeholders. So while spotting this improper behavior, if a child doesn't want to learn, misses school or drops out, perhaps it's better to start at the age of 8 or 9 years, because it's easier to provide this assistance for a child who hasn't yet been applied this minimum care requirements. Sometimes there are problematic families, but the child is very much motivated to receive this help and assistance, and while changing, even while residing in this bad environment, they are not getting involved into any criminal activities. So this is also we can be proud about. And some more photos, because yesterday and today we were talking about children, but there were not too many photos displayed indeed. So this is the good chance for you to see how we engaged in training activities. And while we decide on how to get into good deal with children, perhaps we could get training on how we could deal with grown-ups, meaning vice versa. So this is their recreation activities, different experiences. And specialists also are involved in a training process constantly. I'd like to finish my presentation with a quotation of the director of the center, something we have to consider for the future. Every meeting with teenagers is original thoughts, again and again about the same topic, exterior and inside. Someone who is joined is the written off criminal, but instead we see a young, sensitive person with great painful experiences. I don't even know what should happen to delete this story, which was created by us as a society, while seeing only the outside, only the exterior. So humanity is the best methodology, and I wish you to always think about this interior, this inside inside of children. And I sincerely hope that altogether we will find a perfect way out about this assistance to children. Thank you.
Ačiū labai, Loreta.
Thank you, Loreta.
I'm actually very interested to listen to the presentation of Loreta as she referring to her social partners as we are doing things. We together are doing things, even though she's working in municipality and she's paying for the partners based on the results that they are achieving. But somehow it feels like a kind of the teamwork in order to create the better preconditions for the kids and for the youth. As I have on the stage, so I can use a very great opportunity to announce that from the public impact procurements, one of municipality reached me yesterday actually, and they told me that they find it hard to find the social partners. So it's Joniškis municipality. If you are interested, because they developed the impact procurement on youth, older youth a bit, from 20 to 29, and their employment. So if you are interested, please let me know, and I will direct you to the municipality's representatives. So this is kind of the short announcement. But when I was speaking with Loreta, one very important thing that she mentioned, and what kind of value have she find out from the measuring the impact, is that she told me, at least on those days, that we understood what is missing and what kind of services we are still lacking, or what kind of services have to be improved in order to deliver better. So I'm very glad to invite here on stage Marjatta Kekkonen. She is a senior researcher, public health and welfare department, Finnish Institute for Health and Welfare. As Marjatta will present as a long-term support for vulnerable children, results from the Icehearts longitudinal study. What is very important, that is not only interesting case to analyze and look at and see what kind of the amazing organization results delivered, but also to her feedback of what kind of areas would improve during the period of measurement. So please, Marjatta, the stage is yours.
Thank you. Thank you for inviting me to tell you about this Icehearts model, and especially the results of Icehearts longitudinal study, which we started together with my colleague Kaija Appelqvist-Smidlechner, who works as a research manager in this Finnish Institute for Health and Welfare. And it's a kind of a funny thing that we end this conference with Icehearts. We started this morning with the Icehearts model presentation. And from this presentation, you could find out that Icehearts is quite a unique prevention program, as it lasts through the whole childhood and adolescencehood, from 7 to 18 years. It's based on this relationship-based approach and taking in form of this mentor taking care of the children. It's based on the team sport as a kind of providing this healthy environment, the environment of practicing these new social skills, practicing and combining this peer relationship. And part of this intervention program is, the very important part is that the support is always delivered, provided according to the individual needs of the child. So there is no kind of a general agenda that every child gets a certain kind of support, but every child gets the kind of support he or she needs. And as Mika pointed out in the morning, the families are important partners for the mentors, or other way around, mentors are important partners for the families. But this said, as you can hear, it's a unique program. It promises quite a lot, and in this longitudinal study, we are interested in whether these promises or the claims or the goals, if they really come true. And the aims of our study can be divided in 4 sub-dimensions. The one is to investigate whether the target group of the program is achieved. So does the program reach the vulnerable children the way it claims or promises? And this is by no means self-evident when it comes to the interventions. They may not identify the target group. Secondly, we explore what kind of effects these mentors themselves report in relation to participating children. In other terms, what kind of experiences and observations they do about the child belonging to their team. Thirdly, we investigate the kind of benefits and outcomes of the program from the point of view parents, teachers, and these mentors, and also children themselves. And lastly, we are collecting data from the children participating in the program, and our aim is to see what are the most important transitions and life events and turning points of the children, and how this Icehearts program is connected or related to these experiences. Study participants come out from this slide, so we are searching or we are investigating 5 Icehearts teams in 3 cities. At the baseline in 2015, there were 46 participants. At the moment, when the teams have been grown, there are 65 participants in Icehearts teams. At the baseline, we already also had these control groups coming from the same school or from the same city, and these control group children of the same age and same sex, they did not participate into the program. From this slide, you can see the multiple design of our research as we want to conduct a comprehensive picture, a comprehensive research design about this program. And we are, as I said, collecting data both from children, from the parents, from the teachers and school staff, and from the mentors. We use also, both quantitative measures or quantitative methods, questionnaires, surveys, but we also rely on interviews, both individual interviews and group interviews. And at the moment, there is also sub-research going on based on the observation of the one team. And we have also option to use the kind of register data later on when the teams had ended. So, short summary of some results. First of all, Icehearts program, according to our results, seems to reach the targeted group of vulnerable children. And by the targeted group, we mean that these children really have these adverse childhood experiences, and they were more common among Icehearts children compared to the controls, as you can see from this chart. Children who were invited or enrolled into the Icehearts teams came more often from single-parent families, from divorced families, from the families with low education or income level compared to the controls. They also had, more often, these families, problems with health, mental health, or substance abuse compared to the controls. Icehearts children were interviewed at the age of 7, and they self-reported that they had conflicts with their peers, with other children, they felt tired, or they were worried or sorrowful. And all these are kind of symptoms of not feeling well, being well. According to the mentors, the very crucial figures in this program, so we collect data every year from them, and according to mentors, the impact of the program can be seen, especially in the children's improved self-esteem, mental well-being, social skills, and peer relationships. And besides, Icehearts means a sporty lifestyle for these children. Apart from that, parents get a very intensive and long-lasting social support from mentors for their parenting. They get help to cope with the child if the child is behaving, for example, aggressively. And they feel or they experience that they get social support to support child's school performance and attendance at school. So, and particularly single mothers informed us to get a very intensive support from mentors. Also school staff and teachers reported that Icehearts mentors worked as an extra research for the whole school, not only for the Icehearts children, but particularly for them. So they helped in a very concrete way, but they always did it in cooperation with the teachers, with the principals, or with the other school staff. And apart from that, the Icehearts mentors always try to be present in those meetings where the child's matters are discussed or negotiated, and their role is to support child's view and bring up the child's view for those. And from this chart, you can see the more detailed results from our mentor sub-study. And as you can see, also this physical activity has improved quite a lot according to the mentors. But there are areas where the achievements or the improvements have not been that big. For example, school achievement or school, this non-attendance, it's very low. But family relations or parents' ability to cope. We collected a qualitative interview data from parents of these Icehearts children, and according to parents, there seems to be kind of 4 mechanisms through which this mental well-being of participating children is impacted. So, first of all, parents see that the role of the coach is very important. It's an ethos of caring. It's this positive, encouraging way of being present for the children and functioning as a role model. Most of these mentors, if not all, have some kind of skills in some sport art, and they function as role models for children. Icehearts mentors learned children's sport skills, self-esteem, respect, and help them to cope with failures. So this perceived skills through sport is important one. Icehearts also offered children a team membership, sense of belonging, peer relations, and friends. And fourth one, it's provided safe place after the school hours for leisure time activities, and the place where children could get rid of this extra energy they have. And these kind of mechanisms help to improve the self-esteem and emotional self-regulation of these participating children. And as one mother points out, the importance in the program is that the child is seen as a child, not only as the kind of accumulated problems or symptoms, and this is important both for the child and for the parent. The fact that he is not just this boy with conduct problems, that he is capable to interact with other kids and to play in a team, this is very remarkable, points the mother. And I would like to say also that very important thing in the program from the point of view of parents was that when they promise to keep the child in the team, they are not giving up. So whatever happens in the child's life or however he or she behaves, they keep him or her in the team. And some of the parents had experienced this from the previous sport teams where the child has been sort of kicked out. So he was not accepted when he had behaved badly or had acted against the rules and other kind of things. And according to the latest research results, we could find statistical significant improvement in prosocial behavior among program participants assessed by the teachers. But there was no statistical changes in conduct problems, peer problems, hyperactivity, or emotional problems. And of course, we were a little bit doubtful what to think about this result, but we thought that improvement in prosocial behavior, which is a good sign, may result from being a member of the Icehearts team with a positive goal, with having this permanent positive mentor relationship and a trustful adult. But and the result in itself, that not having this negative development, may be a good result, as it indicates that the prevention has been successful. So from this point of view, we maybe cannot think that this program is a kind of a curative. It doesn't repair the problems of those children who had more severe problems, behavioral problems. So some conclusions about this program: the promise of the long-term support by one trustworthy adult seems to really benefit both children, but also children's parents and families. And this on the basis of the different kind of data. But we know that the program relies on long-lasting mentor relationship, and the mentor's well-being and coping is crucial. And we heard that the NGO is paying a lot of attention to this issue at the moment, so that the workload does not come too heavy. But we have to keep in mind that children with more severe socio-emotional and mental health problems really need support from the services, from the special services, psychiatric services, social work services, and so on. So the uniqueness of the Icehearts is that it may help those children who would not survive in the everyday environment, in the school environment, at home, without the help of Icehearts when they are receiving these special services, help from special services. So in our mind, this prevention function is getting more and more support from the research results. Then I want to point out that Icehearts is actually implemented across the Europe at the moment by the EU for Health Action Grant. And this project is led by the Danish Sport and Cultural Association, ISKA, and there are 6 expert partners and 5 pilot countries, and there will be 14 associate countries in this project, and including Lithuania, Latvia, Ireland, Norway, apart from the others. So there will be a lot of work around the Icehearts around in all over the Europe. So thank you for your attention.
Thank you, Marjatta. We don't have, unfortunately, time for questions. But I would like to note one thing. Before the conference, we have a call with Marjatta, and we were talking about the presentation, about the impact assessment in general. And like I asked her, what are you think the key things why we should like measure the work that we are doing? And she said, like, Monika, in Finland, you won't get any kind of financing without proving that your concept actually works. So this is the thing that I would really wish for us here in Lithuania, because I strongly believe that it would help us to ensure quite at least sustainable financing from the other perspective, very sustainable partnership in between the sectors by understanding what kind of value together we are creating. So thank you very much. Thank you for you, our amazing speakers. Thanks for your time. Thanks for your work. And thank you for sharing your experience. Thank you.